Okay. Hello, let me share my presentation. Just a minute. Okay, here we are. Okay. First of all, I'd like to congratulate all the organization of this meeting. I've been watching the previous presentations, and congratulations for the high quality of this Congress and the bringing to a broader audience the importance of integrating spirituality and health. And here in my presentation, I will talk about the biopsychosocial spiritual approach to health in clinical practice, to show the importance of taking spirituality in consideration. But of course, taking spirituality in consideration does not mean to neglect the other biopsychosocial aspects of health as a whole. Okay. So my presentation will be strongly based on these three sources, these three main reference. This first is a book that we've edited with some other colleagues, and also Peter Fenwick is one of the contributors of this book. This book will be published by Oxford University Press this August. So it brings together the collaboration of many different authors about the clinical implications of spirituality to mental health. We also discuss about the World Psychiatric Association position statement on spirituality and religion and psychiatry. It's a guideline for the more than 250,000 psychiatrists around the globe about the need to take in consideration spirituality in training, research, and clinical practice in psychiatry. And also, we will discuss a little bit about the Spiritist views of mental disorders, about how the Spiritist views on mental disorder integrates the biopsychosocial spiritual approach. Since we are here in the Congress of the British Medical Spiritist Association, so I think it would be interesting to integrate also this perspective. First of all, let's discuss what do we mean by spirituality. There are several definitions about spirituality, but the core idea of spirituality is the relationship with the transcendent, a transcendental realm of reality that is considered sacred, the ultimate truth or reality. The major idea is that in the universe, there is a transcendental aspect that goes beyond the material world, the physical particles and force. And this transcendental realm is the sacred, is the ultimate reality. And religion is the institutional or communal aspect of spirituality, when people share a set of beliefs, experience, and practices to foster the transcendent and the sacred. Okay. It's very important to understand that spirituality and even religiosity is not declining in our current world. This is probably the most recent worldwide survey about religious beliefs from the Pew Research Center. Pew Research Center is probably the most important research center on global religiosity. The most recent finding for about 40 years ago, they found that 84% of the world population has some religious affiliation. And among the 16% that is religiously unaffiliated, most of them have some type of spirituality, such as beliefs in God, gods, spirits, whatever. So, and what is even more interesting, there are several projections, and even in the Pew Research Center also, that the number of unaffiliated is already decreasing and probably will keep decreasing in the next decade. So this is a prediction through 2060 based on the current trends. So we can see here, so probably the number of religiously affiliated people in the world will even be bigger higher than we have nowadays. So it highlights us the importance of taking into consideration this aspect of human experience. However, we know, at least in the last 2 centuries, there has been a narrative of a perennial conflict between science and religion. However, this narrative of a necessary incompatibility, a necessary conflict between religion and spirituality is not accepted anymore in the scholarship, in the good academic environment regarding history of science and science of religion. So here we have three very important books published by University of Cambridge, of Oxford, and of Harvard. Three very good reviews that undermines this prevalent and mistaken perspective that science implies in the negation of spirituality and of religion. So it's very, very worthwhile to take a look in some of these books. So we can understand, of course, that there were some conflicts between some religious people and some scientists, but it's not true that this is the rule, actually. Okay? So just to give you an idea, Ronald Numbers is considered probably one of the best historians of science nowadays, and he edited a book published by Harvard University Press called Galileo Goes to Jail and Other Myths About Science and Religion. It has 25 different myths on science and religion written, each chapter written by a historian that is an expert in that specific subject. And it's interesting, in the introduction of the book, Ronald Numbers states that the greatest myth in the history of science and religion holds that they have been in a state of constant conflict. This is the greatest myth. And when I read for the first time this book that was launched in 2009, I was astonished by the second statement. No scientist, to our knowledge, ever lost his life because of his scientific views, because of religious persecution against these views. So there is no scientist registered in history that lost his life because of religious persecution against his or her scientific views. So it's very, very worthwhile to take a look at this scholarship. But nowadays, since we know that most of the world population has a religious affiliation, and by large, even more have some kind of spirituality, we know now also that religion and spirituality are not necessarily in conflict, by quite the opposite very often. But what have been the findings about the implication of religion and spirituality on health? Professor Fenwick previously presented some findings on this, and here we will present basically a basic summary. There are currently actually more than 3,000 empirical studies investigation the correlation between spirituality, religiosity, and health. On average, these are the most substantial findings and the more robust findings that have been registered. First, the higher levels of religious and spiritual involvement is usually associated with lower general mortality, lower depression, and even higher and faster remission from depression, lower suicidal behavior, lower substance use and abuse, and higher quality of life, well-being, and human flourishing. Of course, there is always the dark side of the force. So there are also some negative impacts, but thankfully, these negative impacts are much less common than the positive impacts. And these negative impacts are not really specifically related to any specific religion, but much more in the way people deal with their own religiosity and spirituality. So the negative religious coping, for example, having a very negative view of God, extrinsic religiosity, people that are basically wanting to take advantage of religion, then actually try to live fully the religious beliefs. And also when religions conflict against treatment, when they oppose regular treatment. So these are some sorts of negative impact on that. Just to provide an example, this is, of some findings of recent studies. This is a large study published by a group from Harvard University, published at Journal of American Medical Association. They followed up 70,000 people for 16 years. After controlling for a huge number of sociodemographic and even clinical variables, they found that, on average, people who attend at least once a week a religious service had half of their mortality compared with those who did not attend. So it decreased by half the mortality after controlling for many sociodemographic and clinical variables. And the main mechanisms, the main mediators, so which factors were related to church attendance that would impact mortality. We could see here that people who attended more regular religious services, they had lower depressive symptoms, lower levels of current smoking, higher optimism, and higher social integration. And these were the main mediators of the impact of church attendance and lower mortality. Specific about suicidal rates, we know nowadays that suicide is a huge public health problem, and this is another study from the same group from Harvard, led by Tyler van der Wiel, one of the major names in epidemiology worldwide nowadays. They followed up almost 90,000 people for 14 years. On average, after controlling for many sociodemographic and clinical variables, they found that people who in 96 attended religious service at least once a week throughout these 14 years of follow-up, they died 7 times less of suicide than those who never attended. Or, saying in different way, people who never attended religious service died 6 times more from suicide than those who attended at least once a week. It's hard to find in epidemiology of suicide any other factor so strong as this. In addition to this, there are also several studies investigating the impact of integrating spirituality in clinical approaches, in treatments. This is a systematic review with meta-analysis developed by a group of colleagues here from Brazil, and they investigate the impact of religious and spiritual interventions in mental health. In this meta-analysis, they found a positive impact of these treatments on anxiety, for example. So the integration of spirituality, the treatment, impacted positively, decreasing the level of anxiety symptoms in patients. This in a meta-analysis of very different studies. But it's very important to stress, we cannot stress enough, that when we are emphasizing the spirituality, of course, we are not denying the bio-psycho-social aspects of mental health. Quite often, we take an approach of one approach or another. So should we prescribe medication, or should we take in consideration the spirituality, or should we take in consideration the social aspects? Of course, we don't need to choose between these approaches. Because we, human beings, we are a whole. We have biological components, our body, our genes, our hormones, neurotransmitters, etc. We have our psychological functioning, the way we see things, the way we deal mentally with the stressors that we face. Of course, we have a social environment where we live, our social relationships, our stressors, our supports, and so on. And of course, we are also spiritual beings, or perhaps we are mainly spiritual beings in a biopsychosocial environment. So, of course, I'm here in my presentation stressing the spiritual aspects, but I'm not at all denying all the other aspects. This is a very important warning. Because quite often, in the same way we see people strongly biologically oriented minds neglecting spiritual aspects, we also see the extreme opposite, people with a more spiritual approach denying or neglecting the biological aspects. We don't need to do this. And actually, as we will present briefly, the Spiritist approach of health does not require that. On the opposite, it stresses this whole. And I like very much to see the health and disease balance is like a scale like this, where we have the pathogenic factors and the salutogenic factors. So we have factors that promote health, the salutogenic factors. And we also have factors that promote disease, the pathogenic factors. And of course, all of us have pathogenic factors, biological pathogenic factors. For example, some genetic predisposition, our diet, our lack of physical exercise, whatever, use of substance. Many of them, all of us also have some psychological, negative psychological aspects, social negative aspects, and spiritual negative aspects. But also, we also have positive, salutogenic, biological, psychological, social, or spiritual aspects. The main focus, the main goal on in preventive medicine and also in promoting the treatment, restoring the balance, is when we can decrease the weight of pathogenic factors and increase the weight of salutogenic factors. So the scale will tilt to the salutogenic side. So the major point in treatment and in prevention is to decrease the pathogenic factors and increase the salutogenic in all the 4 dimensions, because they work in a synergistic way, collaborating with each other to restore balance. So exactly because of this, the WPA position statement from the World Psychiatric Association emphasizes that it's important to understand the impact of spirituality and religion to the origins, the treatment of psychiatric disorders, and also to patients' attitude. It should be central to clinical and academic psychiatry. So we need routinely to take into consideration these aspects of our patients. Who would like to know more about this position statement? It's available online, freely online on this website from the WPA section on religion, spirituality, and psychiatry, religionpsychiatry.org. And this position statement has been translated to 6 different languages, to Arabic, Chinese, French, Spanish, to Portuguese. So everything is available on this website for free. So what about the interventions? So let's talk about the spiritual interventions. First of all, one very good intervention is simply taking spiritual history. Is asking the patient, okay, do you have any spiritual religious beliefs or practices? How do they integrate in your life? What is the impact of these beliefs, of these practices in your life? How do they relate to the current stressor or disease that you are facing now? These very simple questions have impact. There are some evidence nowadays that just by asking these questions, taking 2-3 minutes can increase the patient satisfaction with treatments. These studies have been performed among oncologic outpatients, in general medicine inpatients, and other samples. In addition, because if we ask patients about their own religion and spirituality, they understand that we are taking them in consideration as a whole person, not just a set of symptoms or a specific organ. In addition, we could also have a collaborative approach exploring potential useful spiritual resources from the patients. This is essential. The approach is never imposing the professional's beliefs on spiritual beliefs or anti-spiritual beliefs. This is also important because there is evidence that not only sometimes religious professionals would like to impose their religious beliefs, but quite often also anti-spiritual professionals would like to impose their anti-spiritual views, neglecting or denigring the spiritual beliefs and practices of their patients. So the treatment must be patient-centered. It doesn't matter what we as professionals believe, but what actually matters, what matters to the patient. So in a collaborative approach, we need to explore potential useful spiritual resources, like we need to explore potential social resource, potential useful psychological resources, and so on and so forth. So, for example, some potential useful spiritual strategies, reading religious texts. Many people feel peace, guidance, and solace in reading religious texts. The cognitive framework, how they make sense of the problems that they are facing, how they make sense to the challenges of life. Some religious rituals, listening to or watching religious spiritual programs. Prayer, meditation, community service, attending religious service, deeper integration with their faith communities. This is part, for example, of behavioral activation. That is a kind of treatment for depression. So we could foster this positive religious resource. In addition, there has been a growing recognition in mainstream academic environment about the importance of taking into consideration a partnership between health professionals and religious communities. For example, The Lancet, the very important British medical journal, published a few years ago a series called Faith-Based Healthcare. It's very important to take a look at this series of paper because they discuss the importance of taking into consideration this partnership with faith communities in delivering healthcare, in making also more efficient preventive measures. Some other examples here, the American Journal of Public Health, there is also a recent editorial about this partnership. We published also a few years ago a paper, also in a British psychiatric journal, about the contribution of faith-based health organizations to public health. So, and more recently also, a very good book published at Springer by an important epidemiologist about the impact of religion and spirituality for public health. So it has been more and more recognized and acknowledged this kind of impact and importance. So, as we said previously, here we have a paper that is an overview of some clinical guidelines about how to integrate in an evidence-based and also in an ethical way spirituality in clinical care. Of course, as we said previously, it must be patient-centered, not prescribing, not imposing, neither religious or anti-religious perspectives. We need to take in consideration all aspects of human being, physical, mental, social, and spiritual. Also, we need to have an open-minded approach with a genuine interest and respect by patients' beliefs, values, and experiences. Now, since we have this more general perspective, since we are in a congress about the from the Spiritist Medical Association, what is the approach of Spiritism regarding this biopsychosocial spiritual approach? So we published some years ago a paper about the Spiritist views of mental disorders. It's interesting, as I said previously, because in this paper we reviewed the views not only of Allan Kardec, that is the founder of Spiritism, but also some leading authors like Inácio Ferreira, like Joana de Angelis. So they propose, as I said previously, a biological, psychological, and social approach, the importance of these aspects for the etiology of mental disorders, but also the Spiritism adds a spiritual aspect, a spiritual component. So the point is not to deny the biopsychosocial aspects, but to add, to say, okay, it's very good to take consideration biopsychosocial aspect, but it's not the whole story. We need to add something else, the spiritual. And not only spiritual in the sense of beliefs, of community. Of course, this is important. The spiritual beliefs, the sense of community, the rituals, all of this is important. But in addition to this, the Spiritism adds two other key factors. One is the obsession as etiology, as a negative influence of discarnate spirits, and also the idea that past lives can be, for example, a cause of traumas, phobias, and things like that. And based on this, the treatment would include the conventional treatments, psychiatric drugs, psychotherapy, but in addition to them, not replacing them, but in addition to them, this obsession is a mediumistic treatment for obsession, prayer, lay on of hands, called passes, a spiritual outlook of life. This is very important, according to the Spiritism, that this point of view, that this vantage point proposed by Spiritism, that we are spiritual beings having this bodily experience, that we exist from beyond the birth and after our death. And so we have a much higher and wider perspective of life, and also the strong emphasis in charity. Charity understood as love in action, in living love in all our relationship, and the emphasis on charity and ethical transformation. One of the, perhaps the most important first example, systematic example about the integration of psychiatry and Spiritism was Inácio Ferreira. Inácio Ferreira was a Brazilian psychiatrist who ran for 50 years the Spiritist Sanatorium of Uberaba. Uberaba is a city in Brazil where, by the way, the medium Chico Xavier lived for many years. So he was the director of a Spiritist psychiatric hospital, okay? Probably the first Spiritist psychiatric hospital, and he was probably the first Spiritist psychiatrist, and he published several books with case reports. So we published this paper at the Journal of Society for Psychoresearch some years ago. So it describes in more details his interventions. Basically, in his interventions, he includes exactly this sort of treatments. And more currently, we still have in Brazil dozens of Spiritist psychiatric hospitals. This is also a paper with an analysis of 6 large Spiritist psychiatric hospitals in Brazil. This is an analysis of their profile. Okay, it's also published in a regular mainstream psychiatry journal. Okay, so most of them provide free services, or they were related to the public health system. Okay, and all of them have multidisciplinary teams. Of course, they do not emphasize only the spiritual aspect. They have the spiritual as a complementary aspect of the treatment. Okay, this is the pictures of some of these hospitals. And these are the major mental disorders categories that they treat. Of course, as expected, most of them were depressive disorder, drug addictions, and psychotic disorders. And basically, they combine conventional psychiatric treatment with voluntary-based spiritual approach. This is very important, because in Spiritism, all spiritual activities are completely free of charge. Okay, there is never, it's never asked for any payment or any retribution. It's always understood as a charitable enterprise. So this complementary spiritual treatment is always provided by volunteers. So this treatment includes laying on of hands, talks and conversations on spiritual and ethical issues, and also lectures and also personal interviews on that. Intercessory prayer. The spiritist release therapy, it's called subsession, and what they call the fraternal dialogue. That's exactly an in-person conversation, spiritist topics. They are complementary and optional. Of course, the patients can say, okay, I don't want to receive these treatments. Of course, they are respected regarding that. They do not interfere with conventional treatment. They are always free of charge and provided by volunteers. This is also another paper published about the acceptance of this religious assistance, specifically in a Spiritist Psychiatric Hospital in the city of São Paulo, the John Evangelist Hospital. In 213 patients interviewed in the admission to the psychiatric hospital, it was asked about their religious affiliation. We can see here that most of them were not spiritists. Only 12% were spiritists. Okay, but despite that, most of them requested it because they were asked if they would like to receive spiritual assistance. We can see that by large, most of patients request, even people who had no religious affiliation, about 80% accepted spiritual assistance. And also they were offered different sorts of spiritual assistance, Spiritist, Catholic, and Evangelical, the three major religious groups in Brazil. So we can see here that even the Spiritist approach was quite well accepted, even by those that were not Spiritists, like the non-religious affiliation, Catholics. The lower acceptance was basically among the evangelicals. And here, another very interesting also, so we discussed previously about psychiatric hospitals, now about the public health relevance of the Spiritist groups. So this is a study also published a few years ago in a psychiatric journal about 55 Spiritist centers in São Paulo. So these 55 Spiritist centers were surveyed about what kind of spiritual treatment they provided and about how many people attended and things like that. So on average, each Spiritist center attended more than 100 people every month. So as a whole, all the 55 Spiritist in São Paulo, there are much more than 55 Spiritist centers. Just to give an idea, my city, Juiz de Fora, is a 500,000 people city. It has more than 50 Spiritist centers, only a 500,000 people city. São Paulo, that is, 12 million people, has hundreds of Spiritist centers. But only among these 55 Spiritist centers, they attended on average 6,000 people every month. They had on 95 volunteers, including physicians and other health professionals. The most cited health problem for people seeking the support from Spiritist centers were depression. And the most offered treatments were laying on of hands, the fraternal dialogue, lectures, talks, prayer, and subsession. Unfortunately, we don't have still studies about the impact, systematic studies, not many studies about the systematic impact of these practices, but they are currently in the way. And also, for example, another example, both in Brazil and Puerto Rico, Spiritism has a strong influence. And also discussed about how the Spiritist centers help deal people with schizophrenic and psychotic experiences, how they dealt with their disease, where they cope with them. So we found that the Spiritist approach helped them to provide a cognitive framework to make sense of their experience, provide social support to patients and relatives, And also this experience varied from anomalous but non-clinical experiences, so non-pathological anomalous experience, actual spiritual experience, to schizophrenia. And of course, there were some cultural adaptations of this spiritist approach in Puerto Rico and in Brazil. Another example about the integration of this is I studied, these are 2 PhD dissertations that we mentored from Adair Menezes and Letícia Almignana. We investigated 115 people who seeked help in spiritist centers in Juiz de Fora, Minas Gerais, here where I live. We investigated 115 people who seeked help in spiritist centers because they were having disturbing anomalous experience. And they were recognized by the spiritists groups as mediums. Okay, so they were understood by the spiritist centers as people having troubled mediumship. Okay, so what were the most frequent anomalous experiences that they reported? What we are using here, the language used by the spiritist center. Clairvoyance, that's basically visual hallucinations. They were seeing things, 63%. They were hearing things, 54%. They were have anomalous dreams of precognitions, other sorts of dreams, out-of-body experience, premonitions, all this. So very different, a wide range of different anomalous experience. But what was interesting is that we found that in this sample, we did not find high level of psychotic disorder, but we found high levels of anxiety disorders. It's very interesting because when people have this sort of anomalous experience and they don't have a cognitive framework to make sense of it, and they don't have a social environment supportive of their experience, it of course raises a lot of anxiety, specific fears about their own health, mental health balance. Because quite often they think, oh, I'm going to become crazy, or I'm under some demonic influence. So neither is a good option. So it raises a lot of anxiety. So there are several studies showing when people have a cognitive framework and a social environment that's supportive to them in this anomalous experience, these anomalous experiences tend not to be disturbing when they are non-pathological. Of course, we can have anomalous experiences that are actually symptoms of a psychotic disorder, bipolar, schizophrenia, so on and so forth. Okay, so of course they need spiritual support also, but also they need the medical treatment and psychological treatment and so on. And we performed a 1-year follow-up in that previous sample of 115 people. And we tried to detect which were the psychological predictors of higher or better quality of life 1 year later. It's very, very interesting that having unusual experience are exactly this experience. The number or the frequency of this experience was not a predictor of quality of life 1 year later. So it's interesting because just having that anomalous experience were not predictor. However, having, in addition to this experience, cognitive disorganization, that's actually a more specific symptom of psychotic disorder, in this way, yes, it was related, could predict a worse quality of life later. On the other side, if they have higher levels of ego strength, that's measured by self-directness, it predicted a better quality of life later. So that's the point. When people have anomalous experience, but if they have at the same time a strong ego structure, self-directness, social support, they tend to go better. But on the other side, if they already have some cognitive disorganization, if they had other symptoms of mental disorder, not only that, a specific anomalous experience, it's a predictor of worse outcome. It's similar finding that we found with another study with 115 well-experienced mediums in São Paulo. Okay, we investigated 115 mediums who were, the previous study was people who were just seeking help in Spiritist centers. And there they were understood as mediums and to start their development and so on and so forth. But here, this study, no, it's people who were already involved in the Spiritist centers. They were working as mediums in the Spiritist center. We found among this sample, we published some papers on this, a low prevalence of common mental disorder, a low prevalence of anxiety, depression, of somatic symptoms, okay? And also a good level of social adjustment. And what was more interesting, the frequency of incorporation of full trance actually predicted lower anxiety, depression, and higher social adjustment. Different from what people could think. Okay, these mediums were just some kind of less severe form of psychotic disorder. It's not the case, because the higher the frequency of these experiences, the better were the social adjustment and mental health. And because of that, we have proposed some criteria to for a differential diagnosis between spiritual experiences and mental disorders. So we have worked, including in the ICD-11 work group, to propose some criteria that could help us. So some criteria are psychological suffering. When there is a lack of psychological suffering, is much more suggested a non-pathological experience. But as I said previously, sometimes psychological suffering is caused because there is no cognitive framework or social environment that support this experience. When there is no functional impairment because of this experience, they can still keep working and take care of themselves or their relatives, so on and so forth. It's also a very important aspect, the absence of psychiatric comorbidities, as we said previously. And for example, in a schizophrenic case, in a patient with schizophrenia, in addition to having visions and hearing things, the patient also has cognitive disorganization, blunted affect, other symptoms of the syndrome of schizophrenia that are not present in a psychiatric disorder. Okay, and also very important, they can learn to control the experience with good training, different from mental disorders. And also they experience personal growth over time, different from sometimes a disorganizing effect of more severe mental disorders. So, in summary, I will open the floor for some, to open the floor, to have some space to some questions. I'd like to finish in stating the reasons for integrating religion, spirituality, and mental health. First, most of the world's population has some religious spirituality. It's a very usual coping strategy. It impacts health. Addressing religious spirituality impacts prognosis. Patients want clinicians to address religious spirituality. There are a lot of studies on this. It's a component of the integral patient's assessment, Psycho Socio Spiritual approach. And it's actually recommended by mental and medical and health organizations, as we presented previously. So here are the main reference about this talk. And also for those who'd like to go deeper and having more research about spirituality and health, about spirituality and science, there is this YouTube channel for our research group, Noops TV. It's bilingual. Most of videos are in Portuguese and in English. Okay, more than 300 videos from different authors, from different perspectives. We have including several British scientists, philosophers, historians, physicists in this channel. And here, finally, are my contacts, my social media. If you'd like to be in touch, it would be my pleasure. Thank you very much. Let me stop sharing.
Thank you very much, Dr. Alexander, for your wide-ranging talk. Can I ask you, the forthcoming book that you've got coming, can you say anything more about the content of the chapters in it?
Okay, great. So this book, Spirituality and Mental Health Across Cultures, this book also is edited in the co-editor with me in this book is another Brazilian colleague, Bruno Mosqueira, but also Dinesh Bugra. Dinesh Bugra is from the Institute of Psychiatry in London. He is the former president of the World Psychiatric Association. The book, we are very, very happy, we're very excited with this book because basically most of the most prominent authors around the globe in the field contribute to this book. The book has 3 parts. The first part is about a more theoretical approach. How can we understand the connections between spirituality and health? What are the main evidence about this impact and things like that? The second part is about specific religious spiritual traditions. So we have a specific book, chapter about Islamism, about Christianity, about Buddhism, about spiritual but not religious, about atheism, how these different perspectives of patients impact their own health, and how what the clinicians need to know about these specific traditions to help them to understand and to integrate their beliefs in their approach. And the last section, I think it's one of the most important also, is the practical implications. So how can we integrate this in our clinical practice? Because nowadays, we have a lot of evidence about the impact of spirituality and health. One of the major challenges is how can we translate this knowledge to our clinical practice? How can we perform a clinical practice that is evidence-based, but also ethically sound? So this last part is exactly about these practical guides. For example, in taking spiritual history, in integrating spirituality in psychotherapy, in making the distinction between spirituality and mental disorders and things like that.
All right, thank you. And can I ask you what kind of steps can be taken to ensure that your material and the material of Dinesh Bugra is taken on board in the medical schools? And after that, we've got a question that's come through.
Okay, so I think I'm very optimistic on this. Actually, I've been in this field for about 25 years, and the whole environment is changing. As I said previously, the Brazilian Psychiatric Association, the American Psychiatric Association, the Royal College of Psychiatrists, the World Psychiatric Association, all of them have recognized the importance of spirituality, so it has become more and more prevalent in the textbooks, in Congress, and also in medical training. And we are currently now, I think it's very interesting, we are now currently working in a collaborative project with Professor John Petit from Harvard University. We are developing a curriculum on spirituality for training psychiatric residents. So we just published some papers about this new curriculum, and we are currently now conducting a study, implementing this curriculum in 12 different psychiatric resident programs to see the impact. So the idea is after this study, we would be able to scale up to more residence programs around the globe.
No, that's really good, encouraging to hear that. Thank you. And I believe we have a question for you. From Faye Waddington as, how could you ensure that upon asking a patient about their religious beliefs, your question does not carry any sort of bias or criticisms to any creed in particular?
Very good question, very good question. I think one of the major challenges that the clinicians face nowadays is that most of us nowadays recognize, acknowledge the importance of taking consideration spirituality, but we were not trained in how to do this. We were not trained in how to take a spiritual history properly. So because of that, we have developed some training programs, published books and lectures. But just to give a basic short answer, First, we need to ask in a very general way, for example, do you have any spiritual or religious beliefs and practices? How do they impact your life, your coping skills and things like that? And even if you don't know about the religious tradition of the patient, we could have a genuine interest in learning that. We also need to have intellectual humility. We need to be humble and try to understand this and to have a deep respect for that. And of course, we need to work in our counter-transference. We need to work with in ourselves how, if we have some bias pro or against spirituality, to avoid imposing that. I think actually it works like any other set of values that the clinicians may have.
All right. Thank you for that. May I ask, we've got a couple of minutes left. Is there one more question we can ask? From Stefan Bertozzo, what is missing to have medicine and spirituality walking hand by hand? Thank you, Stefan.
Okay, very good question. Actually, I think it's becoming more and more correlated nowadays. I think what's actually missing is a kind of mindset. I think it's still prevalent, at least in the academic environment, a kind of mindset that I referred previously in my presentation about a kind of necessary conflict between spirituality and science, some myths, historical myths about this. Also the misguided idea that science has proved physicalism, materialism, that all sorts of spiritual ideas are superstition ideas, only people illiterate or sick would believe in or have such experience. Of course, this is not true, and the data is strong on that. So I think the major barrier nowadays is in some intellectual groups that still hold some ideological anti-spiritual perspective.
All right. Thank you very much for that most interesting talk. And I hope people have taken note of your contact addresses. Thank you very much, Dr. Alexander.
Thank you, Natalie. It's a great pleasure being here. And again, congratulations for all the Congress.
Okay. Thank you.